Welcome, welcome, welcome back, my Be Health Empowered family, to another week of Excuse Me, Doctor. My name is Dr. Melissa Clark, and of course, please call me Dr. Mel. I am delighted to be back here with you this week. You know, we are here each and every week doing what we do to make sure that you have the information that you need to make wise health decisions, not just for yourself, but also for your family and even for your community. And so if you're new to the show, please go ahead and hit that like button if you're watching us on Facebook, and hit that subscribe button, that red button, if you're watching us on YouTube. And we're going to get right into it because, you know, in order to make this happen, I have to have my incredible co-host with me, Mr. Wayne Bruce and Miss Lila Mays. How are y'all doing tonight?
Fantastic.
We're trying to get on, Dr. Mel.
Yeah, y'all are hiding out.
We're trying to...
Are you tired from the Super Bowl yesterday or something? You want to come on camera?
I'm in protest.
You know, we need you to bring
the program.
What's that?
Programming. The programming is programming.
I'm in protest.
There we go. There we go. Because
what is it? Is it a blue moon? Not a blue moon. What is that? Where is Mercury in retrograde? That's it. Is Mercury in retrograde?
I don't think you can blame it on that today, but I'm just glad y'all are here in the studio to bring the word from the street and, you know, represent what's on everybody's mind. Glad you're here.
Well,
Glad to be here.
Glad to be here. You glad to be here, Lila?
I am.
So people indeed might notice something different today about Lila. They may notice
that in her brain.
Lila doesn't have a hat on.
But she has the glasses, so
but
you know
she has the glasses. Never fail.
Right.
Never fail.
Right. And you know, tonight is our once monthly show that we co-host with Howard University. There are research centers and minority institutions, community engagement corps. Howard University uses that vehicle to focus on research studies, bringing them to the community, and they're partnering with us to make sure that we too can bring a research focus to our audience. So I want to welcome Karen Parker, who is their project coordinator, and welcome, Karen. Come on in.
We got Karen in here.
Hey, Karen.
We
can't hear
Karen's
you.
On mute. Karen's on. I got her.
Okay.
Hello.
All right. Hey, Karen.
Good to see my BHE family. Happy to be back.
Yes.
Happy February, the month of love.
That's right. Yeah. And the month of Black History. And the month of heart health. It's a lot going on in February.
There's a lot going on, but as we like to say at Howard, Happy History Month.
Happy History Month. I love it. I love it. All 28 and sometimes 29 days.
That's right.
Why we only get 28 and a half days?
We are history, though. That's
it doesn't matter. We're packing it in.
We're going to take all of them. We're going to take all of them.
Right.
We are
and so
taking up space. That's right.
Right. And so what are we talking about today? What's the topic, Wayne? You want to kick us off?
It's, you know, it's a tough topic for men to talk about, but we must talk about it. You know, we must talk about this topic. It's got a pause in it. Women have the men on pause. Men sometimes have a men on pause. So we're talking about men's health, reproductive health, sexual health, however you want to curb it. That's what we talk
about.
Right.
And yeah, we titled this show, Do Men Go Through the Change, right? Or something like that.
Absolutely.
I don't know.
Right.
I haven't been through a change yet. I haven't been through a change. I haven't even changed my pants since 1972.
That's a problem. That's a problem.
Exactly. Everybody watching and listening, get your men folk to ask
please.
questions. Listen. You know, as a black woman, as black women, you black men are very, very dear to us. So this is a very important topic for us. And we know that, you know, recently we had a show about health, Black men's health one, and it came up that men who have loved ones who persuade them, they seek medical help and attention far more. So us black women, we get to continue to support our brothers, our dads, our uncles, our cousins that way. So yeah, any of you watching, go get your people. or at least get this information to them.
That's
exactly.
that's why I let my sister, speak for me. That's
Right. She said it so eloquently. And then tell us about
so much love for it.
right. And then of course we have Howard University in the house, who always supplies us with the cutting edge experts to help bring us these topics. So
We do
Karen,
our
you want to
best.
yes. So Karen, do you want to go ahead and introduce our first guest, Mr. Clinton Burnside?
It's my honor. Joining us one more time, Mr. Clinton Burnside, a wonderful colleague of mine. He has a Master of Public Health that he got from Howard University. He is our Senior Outreach Coordinator and Program Manager of a very special program called Men Take 10. And it's at the Men's Health Education and Early Detection Program at our Cancer Center. So please welcome back Mr. Clinton Burnside.
All right. And also joining us is Dr. Leslie Deane. He is the professor and chief of the Division of Urology in the Department of Surgery at Howard University College of Medicine. And he is an attending urologist at Howard University Hospital. Welcome, Dr. Deane and Mr. Burnside. Thank you so much for joining us.
I love that we have our Bison's experts with us in the house this evening. I'd like to jump right in and send this over to you, Mr. Burnside. Could you tell us about what you do at the Men Take 10 program? What kind of outreach do you do in that role?
Okay, so yeah, excellent. So the Men Take 10 program is a men's health education and early detection program. So essentially what that means is we pride ourselves on providing education around men's health to the community, whether it's men or women or even children as well. But the focus is really just to bring health awareness to the community in ways that they may not necessarily get, just by picking up a pamphlet or a booklet of some sort. And so we pride ourselves in actually not encouraging everyone to come to us all the time, but us actually going out into the community and where they are. And so we do a number of different outreach activities throughout the community in which we partner with faith-based organizations as well as community organizations. And again, really just to promote healthy lifestyle and living, and helping men to be aware of some of the risk factors for different health conditions that they may encounter, either right now or possibly later in life. And even if they're not experiencing some of the health conditions that are existing in their families or amongst their friends as well. So really just meeting individuals where.
That sounds like that sounds like an amazing program. So it sounds like you're uniquely qualified to sort of bring us some of the concerns that you encounter among the men in your program. What is the age range of the men who participate in your program, and what kind of concerns do you sort of hear them raising as a result of aging?
So the age range is pretty broad in terms of we tend to reach 30s, mid to late 30s, and it goes all the way up to men in their mid to late 70s. And I know that's a broad range, but it's almost on purpose, why we want to reach a broad audience, because the different health conditions that men experience, especially as we age. And some of the main risk or main issues that we tend to hear in our program, and not necessarily in a specific order, risk factors for different types of diseases, such as cancer or heart disease or heart conditions. We also hear a lot about men and their mental health. We're starting to hear a lot more about mental health issues in the community, as well as nutrition or a lack of nutrition and exercise in the community. And one of the main things, and drum roll, sexual health. That's always a big topic, especially when it comes to men. Sexual health is oftentimes the number one topic of discussion.
So you said that you do community outreach and you take it to the people. Is there a virtual component to what you do, or is it just to the DC metro area that you do this amazing work?
Yeah, excellent question. So with our overall program, it's primarily kind of local, just in terms of the screenings and that we are able to provide. But we do have a virtual component called Men's Health Awareness Clubs, and that's a monthly men's health group where it's a virtual platform that we bring in different health professionals to talk about health conditions that men experience, and then we kind of open it up to just have general discussion. So it's a great program. In fact, in just a little history of it, we started the program in around 2016, and it was actually just face-to-face, just prior to COVID. And so, we were seeing just a handful, like less than 10 men were participating in the group, but then COVID hit. And so, it was a fear of, I was like, oh my goodness, men or older men, they're not going to, log onto a computer and listen to, a talk or then open up to different discussions. But we were actually really surprised that when we went to the virtual platform, our program actually grew. And I think it grew in part because we were now able to connect men, not just in the local area, but men from all over the United States. We have participants from California, as far as California and the Carolinas, and even we've had some people some down in Puerto Rico to join us as well. So we're actually now able to reach a vast majority of more men now.
That's great.
Fantastic. Yeah. So, it sounds like you really have a reach, and we talked about some of those concerns. So I want to bring Dr. Deane into the discussion and ask you, what is urology and how does it relate to men's health?
Thanks for having me. Urology really is the study of disorders of the urinary tract in both men and women, and the study of these disorders of the genital system in men. So we look at the organs from the kidneys, which make the urine, to the ureters, which convey the urine from the kidneys down to the bladder where it's stored, and then the urethra, the tube from the bladder to the outside. And we really benign and malignant conditions of those organs, in addition to functional disorders of those organs as well. As it relates to the genital system, we look at disorders of the testicles, the vas deferens, which conveys the sperm from the testicles to the outside, the seminal vesicles, these little glands, little organs behind the bladder. And then there's the prostate. There's a prostate gland that sort of has a dual function, being part of the urinary tract as well as part of the genital tract.
So that sounds pretty comprehensive. And thank you for the anatomy lesson, because I'm sure it's a refresher for many. And, we know that as women age, we're familiar with menopause, as Wayne mentioned in the introduction. And that's when women's hormones start to decrease and menstruation stops and a bunch of other physical things happen. But do men also have these changes in their hormone levels as they get older?
They sure do. As men get older, their testosterone declines by about 1 to 1.5 percentage points per year after about age 30. So yes, men do have declines in their hormones.
Okay.
So I do have a question, if I could jump in. As the hormone levels change, does that result in a change in the physique, any physical symptom? And if that does happen, what kinds of changes are we talking about?
Yes, it absolutely does. Men can actually get hot flashes as their testosterone levels go down. And we see this when we treat men with certain hormonal therapies for prostate cancer, for example, that reduce the level of the testosterone. So as testosterone declines, whether you're treating a condition that requires the testosterone to be low, or whether it's declining on its own, men can get hot flashes. They also can get shrinking or decrease in size of the testicles. Some men lose the hair under their armpits. Some men lose their pubic hair. And then there's erectile dysfunction. So the erections don't work as good as they used to work. Additionally, the libido or the sex drive can go down. And when we think about other symptoms related to lowering of the testosterone, men can actually also lose their muscle mass, and they can lose their endurance. So, physical activity, they can't do as much as they were able to do previously.
Mhm. So those are major changes. I mean, is that something that we see in most men or some men, or what are we looking at?
Most men as they age, will have some of those symptoms. Many men are able to compensate by different lifestyle changes, so that they don't suffer all of the ill consequences of the testosterone going down. So, like everything in medicine, there's quite a spectrum. Things that happen to men when they're younger, they may notice that more significantly than men who have a very slow decline over many, many years.
Okay.
So should men just accept this as a normal sign of aging, all these changes that are happening? Or are there certain symptoms that they should say, hey, wait a minute, doc, I want to talk to you about this because I'm concerned about this?
Yeah, that's a great question, because men should not accept these changes that just a part of normal aging, because there are a lot of conditions that with these symptoms. For example, someone with significant high blood pressure may be experiencing some of these symptoms. They may malaise, they may not be themselves. Diabetes as well can present with decreased energy, decreased erections. Coronary artery disease, we know, is the erectile function is a sort of a barometer for what the cardiac function is going to be. So we have to be very careful in just not ascribing these to getting older and sort of becoming grumpy old men, for lack of a better
Right.
Totally
And because
understand.
what you were saying about erectile dysfunction and heart health and coronary artery disease is, the blood flow is what allows you to get erection. So if the blood flow is being affected in your genitals, it may also be affected in other areas of your body. And that's a sign, just as you said, of some sort of heart disease going on.
Absolutely.
So are there tests that you can do to check to see, is this quote unquote the change for men due to decreased testosterone levels versus some of these other serious health conditions?
For sure. One should always start off with the normal baseline test. So you would want to check a person's glucose. You would want to make sure that their complete blood count is normal. Sometimes things like colorectal cancer, for example, that results in a slow decline of the hemoglobin as it relates to blood loss. You don't want to think that a man is getting very tired because he's getting older and miss, for example, a colon cancer. So you want to have those baseline tests done, and then focusing in more on the testicular and pituitary systems. You would want to check the testosterone, and we generally check that early in the morning between 8 and 10 a.m. because that's when it's likely to be at its highest. And certainly, if a person is not working overnight, for example, you need to balance that with what we call the circadian rhythm, which is basically how the hormones are secreted in a pulsatile fashion. And then you really also want to check the pituitary gland function with a hormonal test called LH, which stands for luteinizing hormone. And then you also want to check a prolactin level, because there are little tumors that can arise in the pituitary gland at the base of the brain that can result in the testosterone being low because the prolactin is very high. So we need to make sure that there isn't a more sinister cause for a decline in a man's vitality, so to speak.
So I hear you. First of all, I'm surprised to hear about these hormones that exist in men that I only thought that they existed in women. It's one thing. the other thing is, can you get these kinds of tests from your primary? So I guess what I'm trying to figure out is, at what point does the conversation move from your general physician to a specialist such as yourself?
So generally speaking, if your primary care doctor is comfortable ordering these tests, then I think it's totally acceptable to have them done through your primary care doctor, and then refer to the urologist with the test results, so that things can be addressed from the first interaction with the urologist, as opposed to then having to do the test and wait several weeks to get a return appointment and come back. So in the sense of the efficiency, yes, if the primary care doc is comfortable with ordering them, then I think that is absolutely and totally fine.
Okay. Appreciate that clarity. I have to kind of kick it back to Mr. Burnside for this question, because I know that you speak to groups of men in general. Do they ever talk about depression in these conversations of, feeling new changes? Does that come up?
Yeah, I mean, that's an excellent question. And I guess the short answer would be yes, but a more detailed answer would be, we talk about it, but not directly. It's not like, because, we have our own kind of perceptions on what depression might look like or what it should be. So, we'll ask different questions or kind of go around the world. But when you kind of peel all those layers back, yes, we oftentimes talk about depression, but it's in different ways. And in fact, I think part of it is because, at least for me as a young male from the South, I was always taught to work hard and provide for my family. And so depression and other issues were never really discussed. But as I got older, I began to have different feelings. Like, wait a minute, something is a little off, but I was never really prepared or taught how to communicate that. So I think oftentimes when we talk to men, it helps to kind of be able to give men an opportunity to kind of express themselves, and then kind of over time kind of peel some of the layers back, and then you'll really see that it's truly, or oftentimes, depression, but manifested in some other way. Like oftentimes with men, we tend to get more aggressive, as opposed to just kind of sitting back or crying all the time, or kind of in a dark room to ourselves. So it's just different ways. It's manifested in different ways. But absolutely,
the grumpy old men term that Dr. Mel brought up. Do you then kind of make a gentle suggestion that they might want to talk that over with a professional or a healthcare professional, or what do you say to them?
Yeah, absolutely. And in fact, I try to quote one of my mentors, actually Dr. Johnny Parker, and he says, you can't know yourself and grow yourself by yourself. So it's important that we connect with other men. And I think I certainly refer them to our men's health group, because that's exactly what it is. A group of men, like-minded men, that's really focused on improving their health. In fact, many of the men in our group, they're cancer survivors. But, we don't always talk about cancer. We talk about different issues that impact men, and just having a platform for men to really kind of get together with like-minded men to start expressing themselves. And what we realize is that oftentimes, we have some men that are really quiet and don't want to say much, but oftentimes some of their same questions get asked by other men in the group, and that encourages them to kind of open up and really kind of see exactly what's going on, and it's very extremely helpful. So it's just really just helping men to connect with other men that can kind of steer them in the right direction, and let them know that, yes, what they may be going through, it may be difficult, and it's going to be even more difficult trying to address it on your own. But when you surround yourself with others, it can make it a lot easier for you.
Can we get that?
You brought up so many excellent.
Sorry. I just wanted to hear that.
No. Go. Please go ahead and do that quote one more time, Mr. Burnside.
Yeah, absolutely. You can't know yourself and grow yourself by yourself. You have to be surrounded by others.
I was just going to say, you make so many, that being one of them. And the other is, very few people, men or women, actually come out and say, I'm depressed. It's behavior changes and the way they communicate. And like you said, peeling the onion back. And I think bringing it up in this context of talking about it in the context of falling hormone levels, testosterone, especially understanding that can come with some mental health changes as well, is really important to highlight. I wanted to go back to something Dr. Deane said in terms of ways to prevent some of the effects of falling testosterone levels that you talked about. 1% a year from age 30. That's quite a bit by the time you get to be 60, right? Or 55. So what are some of these preventive measures that men can take, or lifestyle changes that might help lessen the effects of that hormone change?
So definitely there are some easy lifestyle changes that people can make to lessen the decline, and sometimes they actually raise the testosterone. So these would include eating a healthy, balanced diet. Diet is so important to our day-to-day life, and we need to be sure that we are taking in healthy, wholesome foods. And it means not taking in certain things in excess. So, I think if we talk about meats and fatty foods and a lot of carbohydrates and things of that nature, then we can run into problems. So we want to maximize the fruit and vegetables and fresh fruit and vegetables in our diet. We also want to exercise. Exercise is a really good way to help raise the testosterone, but you have to implement it slowly, because if you're not fit, you don't want to go and get injured, because then when you get injured, you don't exercise, you put back on the weight. But you want to have a relatively robust plan and schedule, so that you exercise, so that you drop some weight and you get down to what you think your ideal body weight should be. Additionally, if you smoke, it's a good idea to quit smoking, because smoking also decreases the testosterone. And then drinking a lot of alcohol is probably not in the best interest in this realm. And then we should always try to get a good night's rest. The better you sleep, the more healthy your sleep cycle is. That will also help to bring the testosterone up. So that's very important.
Okay. That's a great overview. And, paradoxically, as testosterone levels fall and people might experience feeling blue, they might increase smoking, or they might increase their alcohol, or they might become sedentary because they don't feel like getting up and doing stuff. So it's really a conscious effort, I think, knowing these things going into it, that you can say, wow, I can't turn to drugs out to alcohol and smoking. I can't let myself become a couch potato. I got going, right? So if
Correct.
you do diagnose low testosterone, are there ways to treat it, outside of these lifestyle changes?
For sure. So, absolutely key to implement as many of the lifestyle changes as you can. And then once you're on a plan to improve that aspect, then there are supplemental testosterone preparations that one can administer. And they basically go from things as simple as a gel on the skin or a patch to injections, to what we call depot injections as well, that last for a longer period of time. And then there's also oral testosterone, which is not as frequently used because of the metabolism as it relates to the liver. So these are all ways to supplement the testosterone, so that we get men into what is a range for them that minimizes the symptoms or reverses those symptoms that they have. We don't want the testosterone to go through the roof. Sure.
Right. Are there considerations like, can anybody get testosterone therapy if you find that their levels are dropping? Or are there some people that you want to be a little bit more conservative in, or people who don't qualify for it?
Definitely want to be a bit more conservative in folks who have a history of prostate cancer. Now, this is a little controversial in that if we thought that testosterone was a significant problem in men who had prostate cancer, then we would be looking to lower the testosterone in every single man who does have or has had prostate cancer. But we don't do that. So people who have been treated for prostate cancer, yes, with careful monitoring, they can receive testosterone. They are people who have significant coronary artery disease in whom you also want to be cautious. And you want to be cautious because the testosterone has the propensity or capability to increase the blood count, so to increase the hemoglobin. That can make the blood more viscous and may result in more cardiac events. Again, this is a little controversial, but we have to be careful in terms of how we administer it in patients like that, and also people who are severely hypertensive, who have very, very high blood pressure. We want to be careful in the population as well.
And just to be clear, by coronary artery disease, that's the kind of artery disease that sets you up for a heart attack. And so essentially, people who've had a history of heart attack, or you're concerned that may have a heart attack, those are the folks that you're talking about.
Exactly.
So, yeah. So, and you mentioned prostate cancer. Certainly, there have been a number of high-profile individuals in the news lately with prostate cancer. We think Dexter King, who unfortunately, Martin Luther King, who passed away from prostate cancer, and of course, Lloyd Austin in the United States, Secretary of Defense, Prince Charles in England, both of whom who are being treated for prostate cancer. Mr. Burnside, have there been a greater interest in prostate cancer as a result of these stories in the men in your program, or men that you've talked about, because of this, coverage, news coverage and media coverage of these high profile individuals?
Oh, absolutely. And you mentioned a few, great individuals, but I also would like to include Joe Madden as well, a local news broadcaster who recently passed away from prostate cancer. So, yeah, absolutely. I'm getting calls almost on every day from different men who's now interested in, getting screened. And, they may not they may not have been screened recently or within the past year, but they may have been screened a few years prior. And now, because we're hearing a lot more about it on the news, they're saying, oh, do you still have that program? I remember I came a few years ago and now I want to come back. And absolutely. And so, I certainly encourage men to certainly use us as a resource, because it's not that, we have all the answers, but we can certainly make the connections like we mentioned earlier. So yeah, there's a lot more buzz around it. And we tend to see these types of trends, kind of up and down throughout the year. But yeah, so definitely right now, we get a lot more men. In fact, so much so we're actually we've actually planned a prostate cancer screening clinic this coming Saturday at Howard University Hospital for the men that are interested.
Wow. So thank you for calling that out. So anybody local to the DC metropolitan area, check out Howard for that free prostate screening clinic.
Clinton, how can people get in touch with the program?
Okay, so yeah, there's a number of different ways. I would say probably the easiest would be to contact me directly. And my telephone number is 202-865-4653. And I'll say that again, 202-865-4653. 4653, or simply send me an email, clinton.burnside@howard.edu. And for those individuals that are a little more tech savvy, you can definitely check out our website at HUHCC.com. And then for the younger individuals, because we try to reach a broad audience, that are into a lot of social media. You can reach us on X, or formerly Twitter, at HUCCDC, or at MenTake10 62023. And we also have an IG handle at HU_conquers_cancer. I know I said a lot, so I'm happy to put that in the chat.
Well, yeah. Well, the beautiful thing is, this program, you can access it on YouTube. So if you didn't hear it the first time, you can go back and listen to it. And there is absolutely no excuse to not reach you, because there are thousands of ways.
All the ways.
So that's
Thanks
fantastic.
so much.
Thank you so much. We have to bring in Lila and Wayne back with us to hear what is going on in Chatland and see what kind of questions the audience is asking, and so that we can direct those questions to either Mr. Burnside or Dr. Deane. So Lila and Wayne.
So we are off
I think
camera.
we can hear you.
Yeah, we'll be off camera to our audience because Mercury is in retrograde somewhere. So Lila, you want to start?
Yeah, there are lots of questions. I'm looking at Facebook right now. So from Yvonne Smith, she wants to demystify this myth. What role does psychiatric medication play, if any, in these hormonal changes in men?
Dr. Deane, you want to take that?
Yeah.
Sure. So there are some psychiatric medications that actually result in an increase in the prolactin level. And when the prolactin goes up, that can suppress the testosterone and can have an impact on the symptoms that we mentioned earlier. So it's kind of a bit by trial and error. It doesn't happen in everyone. It happens in very few people, actually. But we have to be cognizant that it is a possibility, and if necessary, adjust a person's medication based on what they're experiencing while on that particular medication.
That's an excellent question. I just want to put in a commercial for when you get started on a medicine, always ask your doctor, what are some of the things that I need to look out for? And even if they don't tell you anything, be in constant communication with them. Anytime you notice something, let them know right away so that they can monitor and let you help navigate you through that process. Maybe it's just a matter of decreasing the medication. Maybe it's a matter of stopping it altogether and finding something else, to move to. But don't just assume, oh, I don't like this, I'm just going to stop it. So that communication piece is really key.
Excellent point.
What else?
All right,
Yeah.
we got a question coming from Vaughn Wallace. Will working out more preserve the muscle mass with loss of testosterone, or does it matter? Example, working out your chest muscles.
Great question.
That's another really good question. Yeah, so you have to find a balance, and that balance is going to be a moving balance, because you're not going to be as muscular at 75 as you were at 35. So I think it's important to reassess your goals for your muscle mass, because as you get older, you are inherently going to get weaker, and you don't want to be trying to lift the same amount of weights, etc., to maintain that physique that you previously had, because that's when you run the risk of injuring yourself. So you want to be quite cautious in that regard.
All right. What else do we have?
For the doctors, can you just very briefly run down the 4 major hormones in men? We know testosterone, we've heard tonight, prolactin. What are the other hormones that may change as men age?
So the other two would be LH, which is luteinizing hormone, and that's responsible. That's secreted by the pituitary gland in the brain, and is responsible for the cells in the testicle that produce the testosterone, called the Leydig cells. It stimulates them to produce testosterone, and then the fourth hormone, FSH, or follicle stimulating hormone. That's more important in younger men who are seeking fertility evaluations, because what that does is that stimulates the primitive sperm cells to mature into spermatozoa. So that's important in fertility aspects of men's health.
Thank you.
Those were the hormones that you
Wayne,
mentioned, Karen, that you didn't know that men had. Yeah.
I'm getting a whole education here. This is great.
Indeed.
So we have another question coming from Dead Eid. Do CBD oils lower testosterone levels?
I'm sure that's a question on many people's minds.
Right.
Dr. Deane?
So there have been a lot of studies over the years with regards to CBD, whether it's in the oil form or whether it's from smoking cannabis. There are some studies that show that it may increase the testosterone. There are several studies that show that it decreases the testosterone. So I would say it depends on what you're using the CBD oil for. If you're using the CBD oil for a purpose which it helps, then there's going to be a risk benefit balance that you have to consider. And I would look at that from that standpoint.
All right.
So it may help, it may not help. It all depends on what's most important to you, is in terms of the reason why you're using it. Got it.
Exactly.
Hey, Lai, you got another
Yes.
quick question?
I do. I have a question for Mr. Burnside. So, you mentioned that some depression talks come up in the men's group. What are some of how does depression show up? What does it look like as men age and they're dealing with some of these hormonal changes?
Oh, excellent question. I mean, and then it varies again from individual to individual, but oftentimes we see it in men being a little more aggressive, or having a shorter temper, and kind of acting out on some of their thoughts and that some of their behaviors. And again, I think part of it is because we're not always familiar with or comfortable with expressing ourselves and using our words. In fact, we tend to use our actions, and oftentimes it's fighting or being very aggressive, whether it's physical or verbal abuse, or even just oftentimes aggression. And in some cases, some men, we tend to kind of shy away from some of the activities that we used to always enjoy doing, and we would do almost all the time. Like, I know a number of men that they used to enjoy playing tennis or playing golf, and then kind of as they get and their bodies start to change and the testosterone decreases, they have less interest in those activities. And and that's oftentimes, that can actually be a red flag for those around them. That's why I encourage you to surround yourself with other men that can really be honest with you and share with you what's going on, or their observation of what's so that we can better articulate and then have those intelligent conversations with health professionals that can really assist us and to meet our needs.
So this is a two-parter. This is for the panel. How would you coach those men? I know we are speaking to psychologists tonight, but what kind of advice would be useful for men who are experiencing some of these depressive symptoms.
You know, I'd love to
Other
start
than
that just
surrounding
by.
yourself with other men.
Oh well, and I mean, and I think that that's really one of the keys because you know, going back to the quote I mentioned earlier from Dr. Johnny Parker, it's impossible, it's very difficult for us to know ourselves and grow ourselves by ourselves. So we have to surround ourselves with others. And in fact, I go a step further by encouraging men to there should be at least 3 other individuals in your life. I would typically someone who's older than you. Right. And the importance of that is because typically they have experienced some of the things that you may be coming into. So they can help you kind of get through it. Then the second person, someone that's around your same age, because partnering with them, you're able to walk through it together, you know, because you're kind of going through it at the same time. And then the final person I would say is someone who's younger than you, because that's someone who will be coming up and going through those things. And then you can now become a mentor to them, and then you being a mentor to someone younger can actually help you stay on the right track. So you know, again, I'm not a psychiatrist or a psychologist, but that's certainly my recommendations for the men that I encounter.
And it doesn't, and I think those are excellent points. And even when it comes to mental health counseling, it doesn't always have to be a psychiatrist. It can start off with a therapist or a counselor or a licensed clinical social worker who also practices counseling. So there are a number of resources where we can go, where you can direct men to help to talk out some of those symptoms that they're having and help get to some of the root causes from a mental health perspective of what they're going through.
Exactly. So I would like to bring in this question. Are there any disparities in access to andropause treatment and healthcare services among Black men compared to any other demographic groups?
Ooh, great question. Dr. Deane? Actually, both of you could answer that.
Yeah, I would say that yes, they are, because there are disparities in access for Black men pretty much across the board, and it, you know, a lot of it unfortunately depends on insurance status, education status, your interaction with the healthcare provider that you're seeing, and if you've built a rapport with that individual, and if they've built a rapport with you, such that they're going to help to be your advocate and look for opportunities to get the treatments some way that may not necessarily be the straightforward way. You know, you really need to find someone to partner with you who is going to go above and beyond to get the treatment that you need in order to make you feel better, function better, be more successful. And I think that is absolutely critical.
So
And
what I'm
yeah,
hearing
just to
from
kind of
everyone is, please go ahead.
No, I was just going to say, just kind of adding to that is, you know, there's a number of different organizations that exist that can actually assist men, because we do know that not all men will come to the doctor, because not all men have the resources or access to doctors. So it's important that we create more programs. Not saying that, you know, Men Take 10 has to be the model, but programs similar to our program in which we leave our offices and we go out into the community to meet them where they are.
Excellent point.
So what I'm hearing really
Anything
is,
else from the chat?
if there are changes coming on, don't withdraw. Seek help. Reach out
Right.
to someone. That's what I'm hearing across the board. I think
Absolutely.
that's good to take away.
Absolutely.
Yeah, we have a question coming from S. Noel on YouTube. Are there any herbs that reverse low testosterone levels?
So, you know, everywhere we look, we see that there's an herb that is good for whatever entity we're looking at. The bottom line is that many of these sort of supplements or nutraceuticals are not studied under rigorous conditions to really say that this is good for X condition. So I would be cautious with herbal remedies to raise the testosterone, particularly because many of those things can contain substances that are not that may be harmful to you. There may be compounds within those preparations that are not strictly the herb, and it becomes a problem because it's not regulated by the FDA. So I would exercise significant caution in that regard.
All right.
Okay.
Thank you.
I have one, Wayne. For Dr. Mel and Dr. Deane, is sexual dysfunction a symptom of long COVID?
Dr. Deane, would you like to take that one first?
Sure. So I think that is a very good question, and it has not been really studied in a rigorous manner. We know that any infection can result in a lowering of the testosterone, and any significant infection can do that. I don't think that there's any reason to think that COVID would not do that. In fact, I think that we have every reason to think that COVID would potentially result in sexual dysfunction, because we know that if we do autopsy studies, for example, on patients who have had COVID and have succumbed to COVID, we find COVID virus in the testicles. We find COVID virus in the penile erectile tissue. So we know that it is there. What that virus is continuing to do with its presence, we're not sure of yet. But yes, I think that when all is said and done, it is very likely that sexual dysfunction will join the myriad of conditions that are related to post-COVID syndromes or post-COVID. So the bottom line really is, try your best not to get COVID, because, and if you've had it, try not to get it multiple times, because I don't think that there's any evidence that suggests that it is beneficial, and it certainly could be harmful to multiple aspects of your life.
And I just want to add that in contrast to what the social media disinformation says about the vaccine and people's concerns about fertility from the vaccine, there's actually much more evidence to suggest, even though there's smaller studies like one out of University of Miami that looked at dips in sperm count after they had gotten COVID, not COVID vaccine, but actually had COVID, that they did have some dips in sperm count that were statistically significant. Again, as Dr. Deane said, it hasn't been studied on a large scale basis, but certainly the studies more point to the fact that COVID might be responsible for a diminished sperm count, and nothing that has ever suggested that a COVID vaccine is responsible for a diminished sperm count.
Fully agree with that.
All right.
Any other questions?
That's it. That's it, Doc. That's
all
a wrap.
right. Fantastic. Well, you all have been just an incredible wealth of information. Thank you so much to Dr. Leslie Deane. Thank you to Mr. Clinton Burnside. You just have given our audience just so much wonderful information. And thank you, of course, to Ms. Karen Parker, who's such a fantastic co-host in these joint sessions with Howard University, RCMI. And of course, off camera, my wonderful co-producers, Mr. Wayne Bruce and Miss Lila Mays. Thank you so much for making it happen. And of course, the Be Health Empowered family who's tuned in. Thank you so much for being here. Great questions. And until we see everybody next time, remember, be wise, be well, and be healthy. Thanks again.